My name's Brett from Rocktape, and this is Tony, and today I'm going to show you how to tape a shoulder. The shoulder can be for any sort of injury, which could be impingement, rotator cuff strain, a muscle strain through the deltoid, any inflammation, or a bursitis. When we go through and do the taping, we still have to follow a few rules. We have to get the muscle into a stretch position, apply the tape, and then we'll put a decompression tape on. So 1, 2, 3 steps. Stretch, longitudinal tape on, decompression tape on, step 3. Okay, so we'll get Tony up in a stretch position. We want to have the insertion of the deltoid down the bottom. We want the tape to start below that and fold it around. I like to go through almost to the inside part of the scapula, so it's a nice long piece. And when we roll it around, it'll follow the contours of the deltoid back up to the top of the shoulder. Around the corners, and the first 2 to 3 centimetres of tape is placed down without any stretch. Then I have a 30% stretch around the deltoid. I bring it up over the shoulder, so when Tony now drops the shoulder down, I can just roll it up onto the top, about where the AC is. I then get him to bring his arm up again and put the anterior or front part of the deltoid into a stretch position, and I do the same thing. Measure it up about where the tape is. Around the corners. When we put the tape on, we make sure we overlap it, so it's tape on skin, not tape on tape. It locks off the bottom part of the tape. We apply the stretch with about a 30% stretch, roll it up, and that should lock off, then drop his head down a bit, lock off the top part of the tape. And you can see how the tape is encapsulating that deltoid and it's following the contours. If you put on too much stretch, it won't give Tony his full range of motion. And you can see he still has his full range of motion, as well as the support from the tape holding it in position. A lot of times you have the injuries through this sort of area here, and also it'll cause the shoulder to roll forward. So we get a little bit of postural taping happening, and we tape over this particular area here. I'll use the blue tape just so you can see the distinction through there. I start on the anterior part of the chest. This area can be quite sensitive, so there's no stretch put through here. And I come through to approximately where the inside of the scapula is, inside the shoulder blade. Around the corners, you Tony to roll his shoulder back a little bit. Have it on an angle, so it's going to come back over that shoulder joint right in here. The first about the first 4 to 5 centimetres has no stretch on it. Okay. I then put a bit more stretch, about 30% stretch, over that shoulder blade, over that shoulder joint, and bring it back towards the shoulder blade, and I lay it down towards the spine. Tony will roll forward, and you can see how that will actually give a little bit of a spring to allow that to spring back for him, and just hold that shoulder in position. With the decompression tape, it'll actually shrink back a little bit over that shoulder joint, lift up, allow the circulation to increase, assist with the repair of the injury, assist with any pain problems through there, as well as assisting with the postural issues. With this application, you can also use the Big Daddy. You can see that the deltoid comes to a point, and that point is where the V happens within the tape. With the Big Daddy, I've cut it so it's about 4 centimetres worth of tape, which is your base at the bottom. That V will then sit in the same position at the V of that deltoid and roll up and around the shoulder, just like we've done with the 2 pieces of tape here. So you can also use the Big Daddy for this type of application.
More altruistic, because